The only way not to have risk of dying is to be already dead. All right? When we see the risk of total mortality associated with the recommended doses for benefit in the cardiovascular system, does the risk of total mortality increases? Yes. But me, Adrian Baranchuk, is happy to accept certain amount of risk in order to have the life that I want to have. So, if the risk is tolerable, I may assume that risk and continue with my life. And then I live in an urban city, I drive to Toronto, and even when I like it a lot, my tolerance to alcohol is quite minimal, so I drink very little, but not because of a rule. It's because I do accept that amount, which can be a glass every 3-4 days, the risk associated with drinking that is acceptable. Because risk should not be measured as a dichotomic response, yes or no, but as a quantifiable method that allows the individual to determine, I'm going to accept this risk.
Let me know what you think of this quote. Light to moderate alcohol consumption may be associated with cardiovascular benefit, but the line between therapeutic and toxic is razor thin. What do you think that means, Dr. Baranchuk?
Well, thank you for approaching me with this topic. You have to know that it's a quite controversial topic when we talk about the benefits of a possible very toxic substance. So, first of all, and before responding your question, I want to clarify to your audience that alcohol is a substance that we drink, if we like it, to socialize, to enjoy it, and to feel better. But it is not a medication that we take for our cardiovascular system to be better or worse.
Why is that?
Because the components of alcohol, some of them are directly toxic to different parts of our organism. But if you remove it from alcohol, the concept of alcohol changes. So, for example, people may not know that dealcoholized alcohol, so removing the ethanol, is a huge, huge business around the world, but much bigger than what you think. However, in comparison to the amount of people that consumes full alcohol, it's a small business. So one could say why the positive components have not been treated as medications. For example, what if we remove the resveratrol and we do pills of resveratrol without ethanol, without quercetin, without anything else than resveratrol, which is a polyphenol that could be potentially beneficial for the cardiovascular system? Well, there are people working on that. Are there trials that suggest evidence-based benefit? Not yet. But if one day there is a pill of resveratrol to compare how much alcohol you will have to drink to equalize the size of what is going to be in the pill, it's going to be way, way beyond the recommended guidelines. And this is why one should not start drinking because of the potential benefits of alcohol. If you don't drink, don't start drinking. And if your patient, I'm talking to you, colleague cardiologist, does not drink, do not recommend your patient to start drinking because of the potential benefits on the cardiovascular system.
So if I hear you correctly, a glass of red wine a day does not keep the doctor away. That is not validated in empirical science, because the dose you would actually need to consume to get any resveratrol benefits is excessive and would totally negate any benefits there are left by just consuming the toxin.
To me, the intricate component of the sentence of one glass a day keeps the doctor away is dismembering the cardiovascular system from the rest of the body. Okay. What do I mean by that? One glass of red wine a day clearly has improvement in your cardiovascular system. This has been demonstrated by prospective, long-term, well-conducted studies with the famous U curve, where at the beginning there is a decrease on total cardiovascular mortality, and if you keep drinking beyond the recommended guidelines that we can review, up to 2 glasses for men and 1 glass for women, and we can review the gender segregation as well. But if you drink more than that, mortality starts increases. But what mortality? Cardiovascular mortality. It doesn't mean that your total mortality remains the same if you drink alcohol within the recommended guidelines to have cardiovascular benefit. If you dismember the cardiovascular system from your body, I could say definitely yes. But it happens that a sip of alcohol may increase GI cancer. And when we analyze the results of good cardiovascular studies through time, with the absence of any randomized control trial, there are no randomized control trials, it happens that the cardiovascular system was put outside of the total body. And now GI doctors have enough evidence to show that a sip of alcohol increases the risk of cancer. Now, maybe the most complicated analysis, Ryan. And if you allow me, I'm going to get into that.
Please do.
Is risk a dichotomic question that you can answer yes or no? Let's try it with my colleague, sorry if I don't pronounce well, Chuchowski.
That's good. That's the best I've heard.
Does air pollution increase the risk of lung cancer?
Complicated question, but I'd say
I am asking for a yes or no, sir.
Let's say yes.
Yes.
Simple.
However, Ryan, you chose to live in an urban city. You didn't move yourself from where you live, which I don't know, but let's assume that you live in an urban city, to the middle of the field in order to not be exposed to any sort of air pollution. Why? Because the risk of total mortality associated with living in an urban city is to you acceptable to continue living where you're living. Second question, Ryan Chuchowski. Does driving from Kingston to Toronto increase the risk of total mortality?
Yes.
Yes. Maybe 0.0001, right? But yes.
Mm-hmm.
But when you have to go to Toronto, what do? You say, I'm not going to go to Toronto because I want risk zero? You grab the car and you drive to Toronto, or you get into the train and you go by train. And when we were able to fly, you could fly if possible. But you go to Toronto as many times in the year as you need or you want, or you can afford. Why? Because you can live with that risk. You can accept that risk, indicating that being alive is a risk for dying. The only way not to have risk of dying is to be already dead. All right? When we see the risk of total mortality associated with the recommended doses for benefiting the cardiovascular system, does the risk of total mortality increases? Yes. But me, Adrian Baranchuk, is happy to accept certain amount of risk in order to have the life that I want to have. So, if the risk is tolerable, I may assume that risk and continue with my life. And then I live in an urban city. I drive to Toronto, and even when I like it a lot, my tolerance to alcohol is quite minimal. So I drink very little, but not because of a rule. It's because I do accept that that amount, which can be a glass every 3-4 days, the risk associated with drinking that is acceptable. Because risk should not be measured as a dichotomic response, yes or no, but as a quantifiable method that allows the individual to determine, I'm going to accept this risk, I am not going to accept this risk. I look at the Ontario Lake here in Kingston, and I see that people doing the flying on a table. I forgot the technical name of that sport. I love it. I love to watch it. But I am 58, I've never done it. So I'm going to pass. It's not the proper time for me to accept that risk, because I know that you have to have certain capacities, and it's not impossible. But me, I don't feel comfortable taking that risk. I prefer to watch others doing it, or even my daughter doing it. I don't know. But I can't afford that risk. So that is the reflection that I want to pass to your audience. Do not dichotomize risk into yes, no. Try to learn how much is that risk, and if that risk is acceptable to you as a person, as an individual.
How does someone develop that skill to parse out the risk that it pertains to them in their life and barometer to risk?
So some data is very easy to find. Some data is not that easy to find. When you are in this field and you are a paramedic, you are in journalism, seeking for those responses may take you not more than 2 minutes. If you're at home, you are alone with Google, you may end up in the right page or in the wrong page, right? But globally speaking, you will find that not in cardiovascular system, in internal medicine, the recommendation for Canadian institutions is abstinence, which one may wonder whether those sort of recommendations are helping people or not. Why? Because if you classify drinker versus not drinker, we have a problem there. Every single patient that sits down with me to discuss any cardiovascular disease or arrhythmia at some point is going to answer a 10-second question is, and do you drink alcohol? No. Okay. Do you drink alcohol? Yes. And how much? Let's say wine, or you're a beer person? No, beer. How many beers? 6 beers a day. It's a major problem. 1 or 2 beers a week. It's a minor problem. So I quickly can quantify this. And for this, I don't need to be an expert. You meet with your pals, you watch hockey. Hockey is that sport that you hit the thing with a stick. I'm a soccer guy. You're watching hockey with your friends, and you drink 6 beers. You're in trouble. Yeah, that's not good for you as a whole, but it's not good for your cardiovascular system. You're not given time to the liver to metabolize that ethanol that goes directly into the myocytes, the cells of the heart, and impact the cells of the heart. And some people ask me, what means holiday heart? I have heard the holiday heart. And are usually young individuals, more frequently seen in men than in women, that come with cardiac arrhythmias, disorders of the cardiac rhythm induced by a sudden, exaggerated amount of alcohol. And in addition to force us to have to do different treatments to put the heart back in functioning, we have to work very close with these individuals to let them understand that this is not a healthy habit. And of course, there are groups where every society recommends 0 alcohol. And for a quick review, those are teenagers. Why? Because they're still developing their central nervous system, and alcohol interferes with that. And pregnant ladies. ladies that know that they are pregnant is zero alcohol, because metabolisms of the alcohol via blood are going to affect the fetus development. For breastfeeding moms, there are tricks, but they require lots of assistance and directions from doctors. For example, save milk during the entire Saturday, because on Saturday night they will attend that party and they want to have finally that beer that they didn't have for the last 9, 10 months. And then they will not breastfeed for the next 24 hours. So there are some tricks that they can consider. It's not a complete no. But if you don't do that, you cannot breastfeed if you have had alcohol before that. So the groups of people with already determined liver cirrhosis are people that should not drink at all. So as you can see, there are strict rules on who has to have zero. But as our principle is, if the patient doesn't drink, do not recommend the patient to drink based on the potential cardiovascular benefits. To me, it's a quite simple interaction. I ask if they drink. I don't talk with my patients about the possible benefits. We don't have this conversation. I pay attention to how much they drink to be sure that if they drink in excess, we can bring them back to a safer amount. And of course, if I detect alcoholism, I seek the help of experts, and we do have them here in Kingston and in Ontario.
If we go into the weeds, what does alcohol do from a pathophysiology standpoint to the heart and to the myocytes?
So, in small doses, what it does is it promotes vasodilation, which is something that is good, and it promotes endothelial regeneration. That is the inner layer of the vessels, both veins and arteries. So there is a direct impact on that. Those are, in addition, of course, to decrease the progression of plaques, which are developing obstruction of the vessels. Those are the consistent benefits of the small doses. When you keep drinking in excess, you transform what was vasodilation into vasoconstriction. Then, if you have history of diabetes and hypertension, this is even more aggressive than if you do not. But even if you do not, you can have heart attacks associated with large amounts of alcohol. You will impact on clot formation when you drink in excess. And finally, you will interfere with the normal functioning of the myocardial cell, the cell of the heart, making the cells to work less, producing dilation and something that we call dilated cardiomyopathy, which can be a catastrophic consequence of alcohol intake. Depending on how soon since consumption you got the patient and you managed to go to abstinence, to alcohol zero, part of this can be reversible, but the usual stories that we see is when the patient comes at the age of 47, 55, 64, with an irreversible dilated cardiomyopathy. And despite all the treatments that we put, those patients are at a higher risk of heart failure and lethal cardiac arrhythmias. And it's an area.
What happens with the chamber size of dilated cardiomyopathy? Because why does that lead to heart failure?
Yeah. So basically, in the acute scenario, you can have a myocarditis where there is an inflammation of the heart and the chambers, even when they are not very dilated, they are not moving well. And when they are not moving well, they are not pumping enough blood, and the patient needs to receive medications to reposition the ability to pump blood. When this is a chronic phase, the chambers dilate. And I use a figure that maybe you will like. You can have normal size like a golf ball. You can have a mild dilation like a tennis ball. You can have a massive dilation like a soccer or basketball. Okay? The chambers dilate, the walls lose the ability to contract effectively, and there is a combination of the electricity of the heart fails, the contractile capacity fails, and then you start accumulating fluid, first in your lungs, then in the rest of your body. When you accumulate fluids in your lungs, breathing becomes very difficult. So the major symptom is progressive shortness of breath to the point that you have to be sitting. You cannot even lay down because you feel that you're asphyxiating, right? When the right side of the heart also fails is when you start seeing swelling of the legs and your tummy increases in size and you are gaining weight despite of eating very little, and that indicates that the right side of the heart is also failing. So in dilated cardiomyopathy, you can have the combination of a dilation of the left chambers and dilation of the right chambers. And that is the type of cardiomyopathy that is alcohol-induced.
And you said it's fairly common.
It is unfortunately a relatively common cause of dilated cardiomyopathy. It's not number one. Still number one is the chronic occlusion of the coronary arteries. But when we have a patient and we determine has a dilated cardiomyopathy without occlusion of the coronary arteries, alcohol cardiomyopathy or alcohol-induced cardiomyopathy becomes quite frequent. And this is why we quickly include in our initial interactions knowledge about the alcohol habits of the patient.
Does it all start with hypertension as well when individuals consume alcohol at excessive levels?
It's a great question. As usual, the question is better than the answer, because I can say, I meet the patient at the age of 64. He is drinking since his 30s. Was he hypertensive before that? Because in addition to drink, he was eating junk food and consuming lots of salt from, I'm not going to say the names of the rapid, the junk food places, but you know what I'm referring to. But chips and this and that. Was he hypertensive before or after? It's a little bit difficult, but the question is right. Hypertension can precede all this and get aggravated by the consume of alcohol. Hypertension can be a consequence of poor life habits, including alcohol intake.
Correct me if I'm wrong, because I was reading studies to prepare for this, but even one drink of alcohol can increase your systolic blood pressure by 2 to 4 to 8 millimeters of mercury. And in the grand scheme of things, that may be seemingly trivial, but actually it increases your risk of cardiovascular events pretty dramatically.
So the cardiovascular mortality within the recommended guidelines, this is not Adrian's opinion. This is American College of Cardiology, American Heart Association, and the European Society of Cardiology. Do accept the modifications in the blood pressure because they occur within the normal values. Because when you say the 2 to 8, we're going to the dichotomic analysis and philosophy, right? 2 to 8 in the range of 150 to 160, or 2 to 8 in the range of 115 to 125. So if you are a hypertensive individual and alcohol triggers hypertension, it's a must. You should receive a clear explanation that alcohol should not be part of the things that you consume. And structures for alcohol cessation are still in development, while, for example, structures for smoking cessation have taken the advantage of being in the market for many, many years. So something that doctors have to understand is we can do our best, but you also have to live with the, I couldn't call it frustration, but with the limitation that the patient may or may not adhere to our recommendations. Lack of adherence to doctor's recommendation would deserve a full interview in the future, right? But it's in this aspect when we interfere with the life habits of the patient is a very difficult topic.
And it goes back to what you're saying about the dichotomous view and risk. And truly, this is all nuance because, the patient's baseline blood pressure is 110 on 60. It's a lot different than the inverse if they're 180 on 90 at baseline. And it seems almost counterintuitive that in the acute phases of mild alcohol consumption, it leads to vasodilation, but eventually it leads to vasoconstriction. It just proves how complex medicine is. And I'm sure having these discussions with people with no medical background can be difficult.
Indeed. And look in our Canadian history. You are lost in the mountain. They found you with hypothermia, right? Very low body temperature. And what do they bring you? A dog that here in the neck has a little barrel with some type of alcohol, usually vodka or something, those lines. And they don't give you a liter of that. They give you a little glass that you're shaking and you take it. And they vasodilate you with that amount of alcohol. So you're losing more body temperature. And this has been in the back of our memories as kids, seeing that white dog with the little barrel in the neck, right? It's part of our culture and our history. And it is absolutely against any physiological reasoning. So this type of social habits and cultures impact a lot in our life habits and in our capacity to distinguish what is good and what is not good. And alcohol plays a major role in the social habits. It's very unlikely, Ryan, that you go to the house of any of your friends, parents, family of a friend or whatever, and at some point of time, you are not going to be offered a glass of alcohol. Even when you have to drive back, and we know the impact of alcohol drinking in one of the most catastrophic Ontario reasons to die, which is to die in a car accident. Only phone distraction now, currently, is over alcohol. The rest is all excessive alcohol and driving. So there is a lot of social and cultural input. And remember that this is a country that brings together people from different cultures. And doctors bring, as in my case, different cultures from their countries. And we all have to adjust to a similar perspective. Alcohol is a toxic substance that doctors should not recommend. What doctors should do is to try to bring to zero, if that is the case for the patient, or at least to teach and discuss and invest time discussing current guidelines. And that perspective will vary if you see a GI doctor or if you see a cardiovascular doctor. Well, trying to find common places where we pass to our patients similar messages is important. And then the responsibility of each individual is unique. Because if you drink and drive and you have an accident, you cannot say, my doctor said that, because your doctor will tell you if you drink, don't drive, period.